So we did this research due that we know that epilepsy it is a public health challenge in the rural areas, and we needed to see the barriers that preventing people from seeking. So, as we see, there is a treatment gap in treating epileptic patients from rural areas, and we need to understand those barriers and how to improve the care to those patients. So, our objective, general objective, was to evaluating the barrier reported by those patients about why they didn't attend monthly consultation to take medication and other advices. Our specific objective was to assess the structural and economic obstacles and to identify social cultural barriers and to evaluate relationship between clinical engagement and the clinical outcome. So our design, we use a cross-sectional study, and we involve 125 participants. We collected the data in the structural questionnaire, and we analyze it using SPSS. The result we found that the most important barrier to the patient why they didn't seek medical visit, it is barrier to the distances, where 50% reporting a distance as a barrier, and the second one was economical barrier. The results on why the factors influencing treatment adherence, we saw that, as you see on the screen, we saw that when the patient gets improved in the symptom, there is a high chance of attending that monthly consultation. As you saw, we see that there is 55 patients who are reporting that medication help in improving the symptom, and one of them is the one who didn't attending, and the 54, which comprise 98.1 attend due to that factor of medical is helpful. And we try to see on the relationship between those distances, economic barrier to monthly checkup, and we saw that financial constraint, it have a strong relationship with that missing and the distance also, and we saw that the economic barrier also have we saw also that when we consider insurance, as you already see on the previous slide, most of the patients we enrolled in our study, 95% they have mutual, but that factor does not influencing the attendance. And we have we have other hypotheses we needed to improve, where we check frequency versus medication perception, and we saw that when the patient feel that the symptom improve due to that medication, they attend, and it is a strong association. And when the patient, the hypothesis number 3, they suffer or they experience side effect, this is a factor that make the patient also not attending the consultation. So We saw that this study is the first study done in Rwanda about the barrier that make a patient not seeking care. And we saw that there is another study done worldwide, where we saw that there is a study done in South Africa and in Uganda, also that study